Good evening, everyone. As we mentioned, we are here for the benefits presentation for open enrollment this year. I myself am Nicole Young, I'm Shayna Batesman here from Hub, which is really an extension of Jasmine's HR team, as well as Maria from Blue Cross. And so she will primarily go through the changes that we will be looking at for 2026, and then we'll be around after for questions on everything else that is remaining unchanged for the new plan year. With that, I'll turn it over to Maria.
Thank you. All right, slide please. So what we're going to focus on today is the Blue Choice Options new PPO plans. And really what Blue Choice Options is going to give you is going to be giving you actually more choices and actually a great benefit for the majority of you to receive using the same exact providers that you're using right now, right? We've got multiple different networks, and we'll look at those different networks in a minute. And as I mentioned, a richer benefit cost sharing for you all as members. Affordability, access, member engagement. We say member engagement because you'll be able to see, when you show your ID card a little bit later. When you show your ID card for the providers.
Please come to door one. Zoe, South Holland.
Okay. You'll be able to see the better benefit by seeing the same providers for the majority of you that you're seeing right now. Next slide. Next slide. All right. There are two different networks that Blue Cross has that are PPO networks. So I'm going to talk to you a little bit about those two different networks. But most importantly, what I would like everybody to understand here is that Tier 2, which is called the PPO network, is the exact same network of providers that you're using right now, right? So you still have exactly the same access to those same providers that you're using right now in our largest national network, and it's the same exact benefits that you currently have as well right now, okay? So there's no changes to Tier 2, the PPO listing of doctors and hospitals. There's no changes to the benefits, and there's no changes to the out-of-network tier either. As we're all aware, in a PPO plan, you can go out-of-network if you want to, but we're not going to be spending too much time talking about out-of-network benefits because most people do not use out-of-network benefits. And the one thing I will say is that if you did choose to go out-of-network, outside of the Blue Cross PPO network, you're just going to keep paying and paying because the deductibles are more, your out-of-pocket is more, okay? But what we're going to spend most of our time on today is Tier 1, and that's called Blue Choice Options. So Blue Cross actually has another PPO network called Blue Choice Options, and it has just about a good portion of all the doctors that are in the bigger PPO network, but not all of them. Let's go to the next slide. This is really important to look at. So Tier 1, that Blue Choice Options network, we have over 70,000 participating physicians, over 200 hospitals, but most important, 97.1% of all of the providers, all the claims that you all have currently right now, that everybody uses in the district, they're actually in the Blue Choice Tier 1 network. So you can see that, the majority of all claims, 97.1% of them, you're going to get a better benefit by using those same doctors in hospitals, okay? It is also worth mentioning that most of you, 98.8% of you, are using at least in-network providers currently right now. So there's a tiny bit of you using some out-of-network providers, but the majority are all using Tier 2 providers. Right, next slide. Tier 2, 102,000 participating providers statewide, over 270 hospitals. That is the Illinois PPO or Preferred Provider Organization network that you currently have access to nationwide, okay? Next slide. So I mentioned nationwide because on all of your cards, there's like a little suitcase right here. So any of you that have, let's say, kids that might be out of state, or if you happen to go out of state, you're still having access to the Blue Cross Blue Shield or Anthem, provider list of doctors and hospitals nationwide. And what we'll talk about in a few minutes is you'll actually have access to them at a better benefit, if you happen to use those out of state Blue Cross and affiliated providers under what's called the Blue Card Access reciprocal relationship. Next slide. All right, here's the meat and potatoes of it all, right? So Hub did an amazing job of all the educational pieces that you all have online access to. There's a booklet called it's a benefits guide, 2026 benefits guide as well. And that's what this page is from. So I'm trying to see if this is still working. Yeah. You can actually see that what we're going to be looking at and spending all of our time on right now is the 2 PPO plans. The folks that are here do you have the PPO plans? Do you have the PPO plan as well?
I have HMO plan.
Okay. Okay. Great. Okay, somebody here has the HMO plan, is here for this, wants to hear about the PPO options. So great, thank you for coming. All right, so the 2 PPO plans, the way they work is, first of all, on the far left-hand side is the benefit level, and what we call, let's say, primary care physician visits, deductibles, and all that. We'll talk about in a few minutes. And then these 3 columns right here are the first PPO plan, all 3 of them, one plan. And then the other PPO plan that you have access to is called the Value PPO. Now, when you go through open enrollment online, if you want to choose one of the PPO plans, you're going to choose either PPO or Value PPO. Right? There's actually no need to choose which network benefit you're going to actually use throughout the year 2026. That'll happen in 2026. For open enrollment, all you're choosing is the medical plan, either the HMO, or one of the 2 HMOs, or one of the 2 PPO plans, okay? The way this one works, and we have highlighted Tier 1, Blue Choice Options, is that whenever you go to one of these Tier 1 providers in the Blue Choice Options network, you're gonna get a better benefit. Remember I mentioned earlier, 97.1% of all the claims that you all had are actually in that Blue Choice Options network. Now, Tier 2, still the exact same benefits that you have right now, same doctors, listings, and everything. And Tier 3, same out-of-network benefits as well. So again, I'll just mention Tier 2, Tier 3 on both plans are exactly the same as they will be exactly the same in 2026 as they are in 2025. Okay? So starting off with this plan, you'll see that if you go to one of those Tier 1 Blue Choice options, your deductible is actually less than it currently is. So what I'll say is deductible basically on this plan is, for example, for office visits, when you go see a primary care physician, or you go see a specialist, you go directly to that doctor that's in network, and all you do need to pay in this particular tier is that first $500 of copay. So that'll probably take you a couple visits at least to get up to. But after that, the plan pays at 85%, and you only pay 15%. Okay? Whereas right now, the way the plan works is you're paying for the first $750 of your doctor's visits, your inpatient hospitalizations, your outpatient services, etc. You pay the first $750, and then Blue Cross pays 80%. When you're using Blue Choice Options providers, you're actually paying less, up to deductible, $500 for an individual, and then you get more coverage because we're going to pay 85%, and you pay 15%. Now, the way this plan works is that once you satisfy that annual deductible, and in general, there's co-payments on this plan as well. So when you have a copay, for example, like for these prescriptions down here, okay, the deductible does not apply. So the deductible is only applied mainly for, let's say, where there's no co-payments, doctor's visits, inpatient, outpatient labs, x-rays, MRIs, those kind of things, all right? In one calendar year, though, the most that you're going to pay for out of your pocket for one individual is $2,000. If that situation, the worst case situation, hits you, you pay your deductible, you pay your 15%, maybe you paid some co-pays along the way that we'll touch on in a minute. When all of that meets $2,000, that's when Blue Cross Blue Shield starts paying at 100%, okay? And that's in this network, right? Emergency room visits, for example, you pay a $150 copay, then the plan pays 80% after deductible. It's one little minor difference because it's the same as here. You've got co-payments for your retail pharmacy, depending on what type your medication is. You know, generic, name brand on our list, name brand not on our list. Oh, hey, want to sleep? Missy, you over there? Thank you. Okay. So there's co-payments here, the deductible is not hit, right? So the great thing is, this plan is staying the same, tier 1 or tier 2, tier 3, so we actually have a better benefit in tier 1. Jasmine. All right. Now, let's pop over to the value plan, all right? Because the value plan, actually, again, same benefits as it currently in tier 2, the Blue Cross Preferred Provider Organization Network. Same benefits in tier 3 of the network that it is right now. This is what's going to be for 2026. If you go see a primary care doctor, so a primary care doctor, these plans are internists that only see adults, general practitioners that see all age individuals, and pediatricians that see only children. In this plan, you pay a copayment. So right now, you're paying a $100 copayment to see a primary care doctor, or you're paying a $50 copayment to see a specialist. In this plan, look at that. Your copayments to see those doctors are going down. All right, again, going to see those blue choice option doctors and hospitals are going to save you money out of your pocket. This is more of a copay plan because look, you've got copayments for those doctors' visits versus over here. Now your deductible is a little bit higher than this plan here, but much lower, much lower than in tier 2 for this plan. And remember, when you're electing a plan during open enrollment, you're choosing between this PPO, or one of the 2 HMO plans. You don't have to choose which network you're going to use. So let's say, I'm choose Value PPO because I like these copays, all right? I choose Value copay during open enrollment on mine, and then next year, when you see doctors, you'll be either charged these copays depending on which provider, which network the provider is in, okay? So tier 2, copays $30, $50, tier 1 over here, $20, $40, and deductible in the event you have something that is for in general purposes, not a copayment, lab, x-ray, MRI, inpatient, outpatient stays, those things like that. Your first $750 is your deductible. That means you pay for it out of your own pocket. And then after that, Blue Cross pays percentage and you pay percentage. And in this plan, if you use this network, we're paying 80% and you're paying 20%. Or if you landed in a tier 1 hospital, we're paying 85% and you're paying 15%. Again, worth mentioning multiple times, 97.1% of your claims are falling into this smaller network, but still is huge. I actually have this plan as well, currently. So very similar, on this plan you have actually just a $100 copay for emergency room visits. I will mention, if you know where your closest in-network urgent care facility is, because an urgent care facility is going to cost you a whole lot less in your pocket. But if it's a life or limb-threatening emergency, definitely go to the nearest emergency room. It does not matter if that hospital is in or out of network. So for the one individual that actually has an HMO plan right now, quite a bit different plan, because in this plan, you have deductibles and percentages more so. You don't have to follow a primary care physician. You can go directly to a specialist if you like. Okay? Co-payments are, a little different for your prescriptions down here. But again, our focus today is, hey, this blue choice option is new. And if you choose a PPO plan for effective date of January 1, 2026, you will get an ID card as soon as possible. But what I will mention, that's important to mention, is because since you're having open enrollment a little bit later this year than you have in the past, you likely will not have ID cards for January 1. Your coverage will be there. Coverage is effective January 1, 2026, right? So if you do take medications and you're choosing a PPO plan, I would say if you got that maintenance drug that you're taking right now, try to get that medication filled before January 1st under your current card, so that you have that filled and you can hold off a little bit until January 1 for the. Yes, so good question. Somebody asked about whether or not there's an app, etc. Yes, there will be. We'll touch on that in just a minute. On January 1st, you'll be able to actually go in, if you choose a PPO plan, go in, sign up for the app, and sign up and have access to the list of providers. Let me spend a quick minute on the provider search as well right now. So you can actually look up Blue Choice option providers, online as a guest. And go to bcbsil.com, and there should be some instructions in the guide, and you look for Find Care, search as a guest, and then you'll be looking for a PPO plan with the name Blue Choice Options, okay? You click on Blue Choice Options, you copy your doctor's name in there, shows up, and you'll have the Blue Choice Options and the logo right in there in that network, okay? All right.
You've got mail.
Can we go on to the next slide then? All right, that's actually what I was just mentioning, online, you'll be able to go and look up providers as a guest right now if you don't have that network, okay? You can go and look at online before you make a decision. Remember, it's always there for you when you log in later on. It'll go directly to the networks that you have access to based on your medical plan. So if you have an HMO plan, for example, it'll go right to the doctors and hospitals that are in the HMO plan. If you have one of these Blue Choice Options plans, it'll show you both Blue Choice Options and PPO networks. Yes, one question. Yes. Mhm. So the question is for those folks who actually change from HMO plans to the PPO plans, will take 7 to 10 days from January 1st to receive your ID cards. So right now, what I'll mention is whether or not you're on the PPO, going to stay in the PPO, or you're on HMO and you're changing to the PPO plan, it all depends on when the district basically sends the file to Blue Cross, okay? So I would say, it's going to take a little bit, it likely will not be there for January 1st, to be, completely transparent. But your coverage is enforced January 1, number one, most important, okay? And so you will get an ID card, you will have access to Blue Access for members on January 1st. When are you going to change the slide, please? So yes, here's the Find Provider. You can actually call Blue Cross as well, right? And here's the bcbsil.com, and click Find a doctor. I think it says it's Find Care as well. You can also ask your physician's office. Not always the best thing, but if you ask the physician's office, hey, are you in the network? It depends on the person in the office. Really, sometimes if they say, oh yes, we accept that insurance, well, that's a little tricky right there. Accept versus in network is different. Next slide. Right, so there's the dashboard. This is showing you a little bit about what the Blue Access for member looks like. You can actually January 1st you'll be able to go online and actually pull down an ID card, since you likely will not have that ID card right then for the PPO plans. Okay. Those of you who are on the HMO plan currently and stay on that same HMO plan, you can still use your old HMO ID cards. Okay. You'll be able to see, you view coverages, you'll be able to see claims and explanation of benefits. You'll be able to see your spending summaries, how much you've met towards your deductible, how much you've met towards out-of-pocket. The Blue Access for Members website is actually a really great website that actually shows you not only all this, but so much about wellness programs and perks that we can probably spend another hour on talking, but we're not going to today. Okay. All right, next slide. Here's a little bit of viewing of the Blue Access mobile apps. And again, you could go and find the public site, no longer required. You can still go in there and search as a guest. But the app will allow you to, on January 1, download an ID card and show it to any provider with your new group number, etc. Okay. All right, I think that's probably it. Let's go ahead to the next slide. Next slide.
That's it.
That's it. Okay, great. All right, so I'm going to open it up for any other general questions that you think that might be helpful for others to hear about. Just a reminder that that the network tier 1 a little bit smaller, but most of you are using providers in that network already. Okay, and you don't have to choose which network for open enrollment. You just choose the plan. Yes, good. Yeah, so, and Miss, can you go over to the slide that shows the deductibles and the out-of-pockets, the benefits again one more time, and I'll repeat the question. So the question had to do with the different networks and how the deductibles and out-of-pockets cross-apply. So throughout the year, as I mentioned, you don't choose a network right now, you choose a plan, right? So throughout the year, you might actually be using both tier 1 and tier 2 doctors and hospitals. So if you happen to have gone to a tier 2 hospital in this plan, or gotten an MRI somewhere in tier 1, you satisfy the $750 deductible, and then let's say you actually have that surgery at a tier 2 hospital, okay? The deductible that you've met in tier 1 cross applies over to this other network. So that means that the $750 that you've met in tier 1 goes to help meet your tier 2 deductibles. Same thing with the out-of-pockets here. It's called cross-accumulation. So they will accumulate towards each other, okay? Same thing if you do the reverse. If you have satisfied your tier 2 deductible out-of-pocket, whatever amount you satisfied in tier 2 will cross-apply to tier 1. Yes?
What happens if employees are out of state?
Okay, so the question was, if I'm out of state or my child is out of state and I'm on the PPO plan, what type of coverage will I have or my children have out of state? So the great thing about this product, the great thing about the product is that you actually have access to tier 1 benefits when you were out of state, okay? So that card I showed you before, the card, nationwide network that we use, what will happen basically is that provider will be, as long as they are in-network, I'm in Texas, Blue Cross Blue Shield of Texas. As long as I use a Blue Cross Blue Shield of Texas PPO doctor down there, I will get the tier 1 Blue Choice options benefits once the claims are processed, okay? The doctors out there may not know about this Blue Options network. They're like, well, they may ask you for a copay that's a little bit more because they're confused, because this thing is primarily in Illinois. But bottom line is, when that claim comes to Blue Cross Blue Shield of Illinois, we're going to process it under the tier 1 Blue Options because you used a Blue Cross affiliated provider, PPO provider across the country. Is that okay? Any other questions?
Can you speak to one of the key differences between providers and an HMO?
Okay, so the question was, okay, let's talk a little bit about the differences in provider networks between the HMO and the PPO plan. So here in Illinois, again, Blue Cross Blue Shield has multiple products, and we have multiple networks. We don't have a slide that shows the Blue Cross Blue Shield HMO plans, but what I will say is the network is called Blue Advantage HMO, okay? And it is a huge network of doctors and hospitals as well, okay? It's a great product, I've been on that product as well. And you basically, the network might be a little bit smaller than the PPO network, but you choose a primary care physician group. Like here in Illinois, we've got advocates, we've got endeavors, we've got, there's a ton of them. So all the physician groups. So in Blue Cross Blue Shield online system, you choose one of those physician groups, and then when you get your card, that physician group is going to be on the ID card. You call that group, and you choose your primary care physician. And you always go to see that primary care physician for all of your care for whatever the copay and your coverage is on that plan, okay? If you need specialty care, then you get a referral from that primary care physician to go to that specialty care to get the x-ray, to get the lab, etc. And that's the way the HMO plan works. But network-wise, yes, you choose from the network the Blue Advantage Blue Cross network, HMO network, versus the Blue Choice options or the PPO network. Does that help?
Yes, and PPOs don't need the referrals.
No, PPOs do not need the referrals, correct? Okay. All right, I'm going to have the recording stopped unless there's another general question you want to answer. Yes? Okay, go ahead and stop the recording.